Hello, my dear friends, my dear students, and my dear future nursing officers. Welcome back to your channel Nursing Concepts by Raghav. Today I will be discussing one of the important assessment tool in the newborn. This is considered, you can consider it as a very important topic for the upcoming competitive exams. Uh, that we will discuss in the today's video. So by thumbnail you will understood what topic I am taking today. So it is Apgar scoring. Okay, so newborn assessment tool, that is Apgar scoring. So let's discuss the Apgar scoring, what actually it is, how it is to be assessed, and what is the scores to be given based on the assessment for each parameters, and how do we interpret the score, and what is the importance of this, and what type of questions you will get in the exam. That all things we will discuss in the today's video. So let's begin with the today's concept, that is Apgar scoring. So before we start the today's concept, I request, if you are watching for the first time, please do subscribe and press on the bell icon so that you will never miss my upcoming videos. चलिए शुरू करते हैं आज का कॉन्सेप्ट, आपका स्कोरिंग। तो पहले देखते हैं आपका स्कोरिंग क्या है। ओके, सो आपका स्कोरिंग, this is and one of the a very rapid, you can say, or a quick or a fast assessment tool, or we can say the method we use to assess the vitality of a newborn. So every newborn is to be assessed with this scoring system. So this will help you to identify whether the baby is how it is being adjusted with the extrauterine life. That is because the baby, when it is in the mother's womb, the environment in the mother's womb is different as compared to the extrauterine, that is outside the womb. So the baby sometimes feel very difficult to adjust with the extrauterine life. It may faces so many problems during the process of birthing and even after the birth. So it may have some complications to get adjusted with the extrauterine life. So when we assess the baby with this Apgar scoring, it will help you to know how well the baby has adjusted and how well the baby has tolerated the birthing process during the delivery. Okay, so and even it will help you to identify whether the baby needs an immediate care or the routine care is required for the baby. So this is all things we can assess just by scoring some 5 parameters in the Apgar scoring. So this Apgar scoring was developed by an American anesthesiologist. Okay, so that is Dr. Virginia Apgar is an American anesthesiologist. So he started, or he developed this scoring system in the year of 1952. So this is also important. Sometimes you may get an MCQs on the who developed the Apgar scoring system. Okay, even sometimes it is quite possible to get the question in which year the Apgar scoring system was initiated or started. Okay, it is in the year of 1952. So the name, it was developed as by the Apgar, hence the name of this scoring system is Apgar scoring. So in this Apgar scoring, we usually we assess the 5 parameters. Okay, so here to remember with the name itself Apgar as a mnemonic, so the parameters I have denoted with this Apgar. Okay, here it is taken in an haphazard way, but the first we always go with an heart rate. Okay, so first A stands for the activity. So this activity usually assessed by noting the muscle tone. Okay, how the muscle tone is, based on that we give a score. Then P stands for the pulse or the heart rate, and G stands for the grimace or the reflex response. Then A stands for appearance. Appearance is usually identified by the noting the skin color, and R stands for respiratory effort. See this, remember this is respiratory effort, not the rate. Respiratory rate, remember this is very important. So the examiner may confuse you in the MCQs by giving the respiratory rate. Okay, so don't be get confused. In the Apgar scoring system, we are not going to record the respiratory rate of a baby. Instead, we assess the baby's effort in the respiration. Okay, so that is a very important. You must remember this. Here we record or we assess the respiratory effort, not the respiratory rate. So then each parameter, there are 5 parameters. Okay, each parameter will be given a score of 0, 1, 2, 0, 1, 2. So means the minimum scoring will be 0 and the max score will be 2 for each parameters. See, this scoring will be assessed as soon as the baby delivers. So within the first minute we have to assess, and again after the 5 minutes we have to assess the score, or we have to assess these all 5 parameters, first minute and the fifth minute. So this is also important, remember this. Then what this first minute and the 5 minute score indicates. So the first minute, the score that we assess, it will indicates the how well the baby has tolerated the birthing process. So during the process of delivery, how the baby has tolerated. So that score will be indicated by in the first minute, and the score that we assessed after the 5 minutes of birth, that indicates how well the baby is doing outside the mother's womb. So that means how well the baby has adjusted with the extrauterine life. So initially the score what we record in the first minute will be less, and within 5 minutes the score may gets improved because the baby may need some time to get adjusted with the extrauterine life. The score may vary with the first minute as well as with the fifth minute. So usually the score will improve from first minute to fifth minute. And remember, the heart rate will be always the priority in assessment. I told you, always the first assessment or the first priority in the assessment of Apgar scoring, or the as soon as the baby comes out, is the heart rate. So based on the heart rate, not the respiration, based on the heart rate itself, we usually start resuscitation of a newborn. So if heart rate is less, then definitely we are going to start with the resuscitation. So then, as I told, the maximum score for Apgar scoring is 10 because there were 5 parameters. Okay, max score of each parameter is 2. So 5 into 2 is a 10 maximum score, and the minimum score will be 0. So as the score is 0 for minimum score for each parameter is 0. So the minimum score will be 0. So these are all the some important points you have to remember with the Apgar scoring. So then how do we assess the, or how do we give the scoring? See, as I told, the first heart rate will be assessed. So if the heart rate were absent, then a score of 0, below 100, then 1, above 100 is 2. So this 2 indicates absolutely normal or the healthy baby, or the baby has well adjusted with the extrauterine life. The heart rate below 100 and above 100 or absent. And respiratory effort, as I told, we don't record the respiratory rate. Here we do assess the respiratory effort. So if it is absent, means there is no cry at all, then we consider it as 0. Then if the baby is slow or irregular, or if it is gasping, then we give a score of 1. And the baby has a good cry, so that indicates the baby's respiratory effort is good, so we give a score of 2. Then muscle tone is when the baby doesn't make any movements. Okay, we call it as a flaccid movement or the flaccidity. So flaccid or no movement, then we give score of 0. And if it makes some flexion movements, then we give a score of 1. And if it has a very active movements or completely body is flexed, then we give a score of a 2. Then reflex, the reflex is assessed by giving some stimulus. So here we to assess the reflex in the newborn, we do insert the NG tube in the nostrils. So when we insert the NG tube in the nostrils, if baby doesn't give any response, okay, there is no any response even after insertion of the NG tube in the nostril, then a score of 0. And grimacing movement, grimace means some facial movements or the expressions can be seen for the stimulus, there it is a 1 score. And if baby coughs or sneezes to the response or the to the stimulus, then we give score of a 2. Then color, Color, we have to observe the baby's color. If the body completely complete body is blue or pale in color, then a score of 0. Then if it is body is pink, extremities are blue, then it is called as then a score of 1. So when the body's extremities are blue, so we call it as an acrocyanosis. We call this as acrocyanosis. Acrocyanosis. So acrocyanosis usually indicates the hypothermia. Hypothermia in the baby. So the baby body is pink and extremities are blue, and if the body is completely pink, then we give a score of 2. So like this we do a scoring system of the baby. Okay, then if the score is 7 to 10, then absolutely normal, and if the score is between 4 to 6, then moderately depressed, and 0 to 3, then baby needs an immediate resuscitation. So let's discuss how do we interpret this score. So if the score comes between the 8 to 10, okay, then we consider it as no distress, means the baby has well adjusted and absolutely fine, and there is no any action is required, just a routine newborn assessment or the newborn care is required. That can be done, like drying, suctioning, and keeping the baby warm. So that routine care is enough for the baby. If the score is 5 to 7, then we consider it as a mild distress, where the baby requires a normal routine care along with the observation, like suctioning, warm care, and the baby may need an oxygen. So in the case of mild distress, the baby may requires O2. Then if the score is between 3 to 4, then it is we consider as a moderate distress, where the baby needs suctioning, then oxygen therapy, nearly 5 to 8 liters. Then stimulation, we have to stimulate because the baby's respiratory effort is not good, or if it is baby is gasping, then we have to stimulate the baby just by flickering the sole of the baby or by and back rub, so that it can initiate the respiration. So these all things can be done. So if baby is not initiated the respiration, or breathing is not effective, then we can start with the IPPV just by bag and mask, that is positive pressure ventilation. We can start with the PPV, positive pressure ventilation, by bag and mask. Then if the baby is score is less than 2, then definitely the baby needs to be an immediate resuscitation, needs to be intubated and ventilate the baby with the continuous positive pressure ventilation. Here in this case it requires an IPPV, where in the severe distress case it requires a continuous positive pressure ventilation, and baby needs an intubation and needs to be kept on the mechanical ventilator. So this is how do we interpret the score. So that means the score of an Apgar score will help you to initiate the resuscitation. Apgar will help you to initiate resuscitation. So based on the score, you can go with the, or we can start the neonatal resuscitation. So we'll make an video. Definitely, I'll make a video how the neonatal resuscitation will be done. What are the steps we have to follow, and what we have to observe. Okay, so what at what time we have to give the injection. All these things we'll discuss in the neonatal resuscitation video. Okay, very soon I will make the video on the newborn resuscitation as well. So this is all how we assess the or how do we interpret the score of Apgar scoring. So this is all for the today's video. So let's revise briefly with this. Okay, you just remember these points. Apgar. Okay, here we assess the 5 parameters: heart rate, respiratory effort, muscle tone, reflex, and the color. Each parameter is given a minimum score of 0, max is 2. Overall the max score is 10 and the minimum score is 0. Okay, so in general we can interpret like 7 to 10 is normal, 4 to 6 is moderately depressed, and 0 to 3 is severely depressed, where the baby needs an immediate resuscitation. Okay, so that's all for the today's video. And if any doubts you have, then please do comment. I will clarify your doubts, and please do subscribe and keep watching my channel, and press on the bell icon so that you never miss our next videos. And please share it to your near ones and the dear ones, So as I always tell, sharing is caring. Please do that. So it will help your friends, those who are in need. So till then, take care and keep studying.